Hi, good afternoon, everybody, and welcome to this webinar. Today, we'll be discussing the best practices for primary care providers to manage patients with chronic conditions between office visits. Just some housekeeping rules. If you have any questions, enter them in the Q&A option and we shall entertain them towards the end of the session. Uh, I'm excited to introduce our guest speaker for the session, Rob Sanchez, the Chief Business Development Officer at Proactive Wellness at Dallas. Rob is an expert in remote patient monitoring softwares and devices with over 24 years of healthcare experience as an RN and someone who holds an MBA. Since 2011, Rob has been developing RPM programs that align with value-based healthcare goals and achieve HEDIS KPIs and matrices. He has also worked with the American Heart Association to integrate care plans into clinical workflows, benefiting patients with chronic conditions. At Proactive Wellness, Rob oversees sales, strategy, marketing, product development, and customer service. He has also served as the co-chair of the U.S. policy work group for the Personal Connected Health Alliance, PCHA, and is the member of the RPM advisory board at CTEL. Over to you, Rob.
Thank you very much, Mustafa. Appreciate the opportunity to be here and speak with you guys on a topic that is always top of mind when I speak to new clients and existing clients in terms of how to manage patients in between visits. A topic that I'm glad to get more questions on as I meet people, simply because they're starting to see the value of how to utilize RPM beyond just the auxiliary service that it is in terms of taking vital signs. So they're starting to look at ways of using it to leverage it as a strategy. So I'm excited to see that because that leads to more opportunities and greater use cases for the world of RPM. So let's kick things off and why is there a need for RPM with chronic care management in particular? So, when I talk to physicians, and I'll be kind of referencing providers in terms of general bucket to consist of family practice medicine, PCP offices, internal medicine practices. Those are the key primary groups that we tend to talk to on a daily basis. So if I reference that, that's kind of the whole body that I mean. But in between visits, it's critical to understand these patients that have these chronic conditions. What we tend to see is there's a lack of communication or very disjointed communication that can take place typically. Why? Because the offices are very busy. The PCP's offices are busy with day-to-day items. They may not have the bandwidth or a care manager embedded within their staff to coordinate some of the needs that patients need with other specialists. So we tend to see that sometimes with patients that have multiple comorbidities, their care can be a little fragmented. So this leads to a struggle of the inadequate communication with the specialist, things such as medication changes, treatment plan adjustments, anything that can have an implication in drug duplications, for instance, sometimes still common. So that can compromise the patient's safety and regimen. So when you have an RPM program that is consistently checking in with patients and evaluating their progress, these are some of the things that a good quality care, not care plan, but monitoring program will touch on, right? And ask the patients these questions to understand how they're doing with their medication regimen. Are they taking it as prescribed? Are they having issues filling it, etc.? Then from there, we're able to tie and connect those dots from sometimes the specialist to the PCP and ongoing. So it helps for a program like Proactive Wellness to be in the middle of it to help quarterback that in between visits. Secondly, what we see is the time constraint and the complex care needs that the patients have. So there's more, typically these visits tend to be longer. There's more frequent follow-ups. and there's more care coordination that needs to take place among the specialists. So again, the primary cares are often too busy, and having to balance these demands can be a lot of work for them. So again, program like this is in the middle to help facilitate that. And lastly, patient adherence and self-management issues. Addressed it in the first bucket, where we continue to see patients that have difficulty adhering to the treatment plans, the medication regimens. So being there, being that voice of the PCP that helps track and follow the physician, the provider's plan of care, is going to be a crucial piece to help them achieve the goals that they want to achieve. So before I go any further, I think it's important that we kind of take a step back and evaluate and understand how RPM works. Won't go deep into this just because it's pretty common now, but there are things that are very important that I like all my providers to understand. First, quick overview diagram is how we collect the data. In order for this to be reimbursed and applicable, these devices that are placed in the patient's home have to be a connected device. That's number one. That data has to come to a central platform that someone monitors, manages, and then does outreach to the patient. So first and foremost, you want to have reliable devices, and there's two flavors. One is going to be a Bluetooth that connects to your application on your mobile phone, and then the other one is going to be a simple device that has a cellular chip in it that connects to the cellular tower and sends data to the cloud, to the platform. Both have their pros and cons. Be glad to talk to you guys about the pros and cons on a call or offline on that. But that data gets transmitted then to the platform, as I mentioned, where a nurse team will evaluate that. Now, many times providers don't have the bandwidth, they don't have the staff to operate a call center, so they lean on companies like Proactive Wellness to manage that. So you want to make sure that you've got a nurse monitoring program in place that's going to oversee, evaluate, manage, and identify the patients that need help when those readings come in. Then you notify those patients, make sure that those patients are also aware of their readings and also aware of their trend levels. So lastly, the most important piece is going to be that follow-up with that patient and in that intervention call that takes place. Here, we're looking at a nurse call center that's going to touch base with the patients to coach, triage, educate the patients. And that's where a lot of the work that I talked about in the prior slide takes place. So now we're doing the legwork. We're identifying what we need to relay to the physician and their practice in an actionable sense, so that the doctor or the NP or PA gets that data in a way that kind of flushes out all the minutia. So we're providing them with the information, the next steps. So now that you've got that diagram of how RPM works, the next thing is, how do we implement this in each practice? So first things first, we have to analyze the patient demographics. Each practice is going to be different. There's going to be different age groups typically that the providers tend to focus on. There's going to be different insurance plans as well. So we want to be able to give that provider an ideal look of what it would look like an RPM program would look like in their practice. So analyze the patient demographics, step one. Step two is going to be design an onboarding process specific to that practice. What I mean here is going to be, how does that initial assessment look like? So typically the patients will come into the office, they'll have their consult with their provider, and at that point the provider will make a decision if indeed this patient requires a program like remote patient monitoring to manage their condition, right? We need to keep a closer eye, because I'm not going to see you again in at least 45 days or 6 months. So I need to make sure that I'm keeping tabs on your progress and on your new plan of care that we've developed, right? So we've got to create that type of assessment and convey the message to the patients of the importance of program for RPM. Then the next step is device distribution. how you handle giving the patient a device. We can have someone there in the office, or we can mail it to a patient's home. Um, Pros and cons with that as well. But for the most part, the most success that we've seen is being able to have someone in the office to talk to the patient, onboard them, give them the device, set them up for success from day one, sign them up into the program, into the platform, and then they go home. The following day, there's a follow-up call from our nurses, welcoming them to the program, answering any questions now that they're at home with their device, and then moving forward from that day on, we start the program and taking their vital signs officially into our platform. So that's part of the training protocol as well. And what we want to have an understanding of is when we're going to reach out to the doctor's offices. So we want to establish a point of contact. Typically, is not going to be the provider. It's going to be a lead MA, a nurse, maybe even an office manager. But every office is important. So we want to be able to understand who do we need to talk to in case of an elevated reading, in case there's a critical alert that we need to send you the information, our triage information, so that next steps can take place. So we want to identify those roles and responsibilities early on. Along with that, the next part, the last part, is going to be reviewing the billing process. So I've got identified the clinical portion, the key players in terms of who does what from a clinical perspective. The next piece is who is my billing contacts, because unlike an office visit or any other type of program or test that's done when the patient goes into the practice's office that day, this is all billed on arrears. So they order it at the beginning of the month, and it's not till the very next month that we're able to file our claims. So it's important that we coordinate with that billing person to let them know and what to expect, that you're going to get the billing claims at the end of the month, at the beginning of the month for the prior month. And at that point, you file your claims. Now, that's going to be important because we've got to train them in terms of following some of these billing practices. As you know, it'll take Medicare to reimburse anywhere between 20 to 30 days on average, even your insurance plan. So there's going to be that delay, number one. Number two, there may be some denials for whatever reason. Maybe something was left off, but we need to keep track of what gets paid, what doesn't, if there's on denial. So you want to look for a system that's able to track that efficiently, and keep you and your service provider organized. Okay. So along with setting up the program, you've got your technology, you set up your protocols. Now the real work begins. Right now is some of those challenges that I see every day with our offices and the team. And what's important here is understanding that the offices have a busy schedule as is. They probably 9 times out of 10, they don't have the bandwidth to manage a program like this. And it's important that they recognize that. Why? Because they may think that it's going to be easy for them to say, hey, I need you to take your blood pressure every single day. I'm going to keep an eye on it. Patients will forget. Patients will take that device home, set it aside, and forget it. So the constant nudging and reminders have to be in place, number one. And number two, the patient has to understand the value of it, right? So there has to be a program embedded in place so that the patient recognizes it and says, hey, I need to track this for my well-being. I need to understand that it has a direct impact on my health. And understanding this number is a value add. So having a program in place that addresses the engagement piece is going to be critical. And I guarantee you that in talking all these years with my practices, they just don't have the manpower, the bandwidth for that. And then that's the most critical piece, because the last thing you want is to hand out devices and nobody takes their readings. And nobody takes their readings, and it's a loss of money on your investment, and it's just a loss of time from your staff as well. Because at the end of the day, at the end of the month, you're not going to be able to file any reimbursements. So it's critical that you have a game plan in place, that engagement piece is there. The next part of the challenges is ensuring proper reimbursement is in place. So it's very easy. You can think that in theory, it's very easy to, hey, I need 16 readings, 16 days of readings in a 30-day period. Okay, that sounds lazy, but it's not for the patients to do that. Number two is I need 20 minutes of oversight, care, and management to take place. That could be a lot of time. So it's important that you have the staff in place to make those outreach phone calls, to have that two-way communication with that patient, and be there in their hour of need, right? Sometimes it's just not possible, because if you're having an MA and you're also managing patients coming in, answering phone calls, greeting patients as they walk in, walking to the back, the last thing that you want and you're focused on is doing this patient engagement over the phone with for remote patient monitoring. So important that that whatever is done on a day-to-day basis, it's tracked and documented. If it's not tracked and documented, it wasn't done. So at the end of the month, when we finish our program for the month of September, we're going to have a document that outlines all our calls, all our communications via text messages, and everything that we did for the patient, time-stamped and documented by our nursing staff. That way, that gets filed in your patient's EMR, and that way, if there's ever an audit, we have all the documentation in place. And that's going to help substantiate our claims for tracking purposes as well. Okay. The third piece here is future use case of RPM. And this is an area that excites me. Just, I've been doing this since 2011, been in the world of RPM since 2011, where we used it for a home healthcare agency very successfully to help manage patients post-hospitalization and ensuring that they don't bounce back to the hospital. So the play was very similar. We want to make sure that we identify and intervene. But the nice thing there is that we dispatch nurses to the home. So back then, there was no reimbursement for it. So it was very difficult for many companies to justify adding this type of technology onto their service offering. And by the way, the cost of the technology back then was probably tenfold what it is today. So now we keep our eyes on different emerging technologies, with everything from wearables to AI. And what I'm seeing now, one of the areas that I'm bringing up today for you guys is the use of RPM for understanding and managing Parkinson's disease. So Stanford created a new application that measures tactile in Parkinson's disease. So it closely monitors patients' tremors and bradykinesia without having the frequent in-person visits. So that's a great way of managing patients remotely. Second, it detects potential early complications. So they're doing a lot of research right now where they're looking at medications for Parkinson management. They're looking at the tremors, and they're correlating the two. Third, they're seeing adjustments in being able to adjust real-time medication adjustments for the patient progress when it comes to those tremors, and delivering those early interventions as needed. So it's great to see how they're using RPM in different areas. I'm sure that this is a growing area where we'll see more reimbursement open up in the years to follow. If you're interested in learning or more about this study from Stanford, hit me up. I'm going to share my contact information afterwards. Send me a text, send me an email, and I'll be happy to share that document with you guys. So lastly here, before finish up, want to touch base on an area that's also really important, which is going to be my ACOs. So we talk to a lot of ACOs, a lot of ACO affiliate practices. They all want to know, how can we use RPM to hit some of our goals? So we talked about HEDIS goals earlier in the presentation. Um, you got to remember, put yourself back before 2020, where there was no reimbursement on this, and it was just an afterthought using RPM before. Care management would go blind, would manage these patients blindly, meaning they're following up on the patients at home. Patients would maybe typically write their medication, or excuse me, their blood pressure on a journal, and then they'd read it back, or they'd go back to the office and with their little piece of paper. So that's good. That's still done a lot today. But what we tended to see with our case managers that, hey, this helps me speed through. And it becomes a way of scaling a program and speed through managing a number of patients better than the way it was before. So with RPM as it relates to HEDIS, there's three key areas. Number one is medication management. So now we've got a targeted way of understanding how that patient is doing and focusing on those patients that need this, that need us the most. Number two is better chronic care management. So think of diabetes and hypertension. It's better. This is better for them simply because, as it relates to HEDIS, this is a triple weighted score now. So the better we are at keeping tabs on our patients throughout the course of the year in relation to their medication adherence and medication management, the better we're setting up our practice to meet our ACO goals, and then thus hitting that HEDIS metrics. And then the last piece is enhancing patient satisfaction. So if you're already providing quality service from your practice, fantastic. There's so many providers out there that are already doing so. They're already killing it with providing good level of service day in, day out. That's why these patients continue to stay with you. They continue to go back. Adding a program like RPM is not going to detract any from that. It's only going to enhance it as well. So we've got so many clients that offer that good quality service. They stack this on top. These patients are very pleased because they feel that extra added eye and attention and access to a nurse that we're able to provide. So we work hand in hand with our practices. We're an extension of their program. We're a partner of theirs. So we want to make sure that these patients receive that virtual hug when we call them. And if you're struggling from that perspective, adding something like this is going to help your practice. It's going to help you shine in those areas where you may be weak. And sometimes just because you don't have the bandwidth, right? You don't, I always go back to having that right staff to support you. Maybe I see so many patients that go back to their doctor's office for that physician or that provider. But that follow-up is sometimes something that needs to be sharpened up. And a program like this, an auxiliary service like this, is a really nice way of making sure that you're addressing some of those areas of weakness. All right. I'm stopping a little early. We zipped through it. I want to take a little bit of time. I'll pass it back to you, Mustafa, for any questions that folks may have had. I think I saw a couple come up.
Hi, Rob. Yes, we have two questions. One of them is from Andrew, who says, "Hi, Rob. If a patient has multiple comorbidities, is there any reimbursement coverage for multiple devices?"
That's a good question, Andrew. So you would think that there would be coverage for multiple devices. We get a lot of patients that have diabetes and hypertension, but unfortunately, the rules are such that you will only get reimbursed for one device, or you only get, like I tell my kids, you get what you get, and you don't throw a fit. You get your reimbursement allowable, which is generally around $50 to $52. And with that, you can apply one device or 5 devices. It doesn't matter. That's all you get, unfortunately, right now.
All right, thank you so much. And now we have Hassan, who says that you mentioned nurses intervene and collect data to provide actionable to provide some actionable data. Can you shed more light on that? My doctors are concerned with data overload.
Yeah. So, so I think I think as I look back at the journey and the growth of RPM, one of the things that I saw, or that we all saw early on, was managing this data coming in, an influx of blood pressures and vital signs coming in, and they would just be sent back to the doctor's office. Um, Doctors just didn't like that, right? Because they felt like, now I'm on the hook for knowing, all these blood pressures that really are not critical. Yes, they may be high, but the patients are asymptomatic. They're doing fine. It's just part of the therapy that we need to work on their blood pressure and get it down, and it's going to take some time. So now I'm stuck with a blood pressure, let's say that's 140 over 80. Yes, that's elevated, but nothing to be done at that point. Those are the type of data numbers that we will reach out, will speak with the patient, will assess the patient virtually, and we'll make those documented notes. Patient's asymptomatic, denies any shortness of breath, blurred vision, etc., chest pains, etc. We'll track that. We'll document that in the chart. Now, if something's elevated, 180 over 90, patients reporting some dizziness, things like that, then yes, that we're taking to the physician, and then we're justifying it. Here's the situation. Here's what the patient reports, taking their blood pressure medications routinely, and that way they have a better picture. They have a better picture of hey, if they've been adherent to their medication, B, if they've been adherent to their regimen. Given that, now the providers have a better course of action, right? They'll have them come into the office for an urgent visit, perhaps, and then thus avoiding that hospitalization. So that's what I mean by actionable data, so that the physicians and their team knows what to do and better handle that situation.
All right, thank you so much. I think those were all the questions that we had. And do you want to add in any follow-up notes, Rob, like to end it all?
No, I want to thank everybody. We're going to want to thank everybody here for their time, for jumping on our call. I'm going to try to make webinars like this more routinely, 30-minute increments, so you have bite-sized pieces of information that you can take back and you can apply for your practices. Here's my contact info. That's myself. You can feel free to text me. My email is rob@prowellcare.com. You can email me any thoughts or questions you may have about the world of RPM, chronic care management, and how we can help you. But thank you very much for the time.
Thank you, Rob. It was a pleasure having you. And thank you everyone else for joining in the call as well, this webinar. We'll be posting more webinars and stuff on our website, as well as on our Facebook and our LinkedIn. So please do follow that up at Proactive Wellness. Thank you guys, everybody. Have a great day.
Thank you.